Today I will talk about osteomyelitis. Osteomyelitis. An infection of the bone is termed osteomyelitis, myelo equals marrow. A number of systemic infectious diseases may spread to the bone, such as enteric fever, actinomycosis, mycetoma, and syphilis. However, two of the conditions which produce significant pathologic lesions in the bone, namely pyogenic osteomyelitis and tuberculous osteomyelitis. Pyogenic osteomyelitis. Pyogenic or suppurative osteomyelitis is usually caused by bacterial infection and rarely by fungi. The profile of patients in developing and developed countries is different. In the developing countries of the world, it may occur by hematogenous route, most commonly in the long bones of infants and young children, 5 to 15 years of age, called hematogenous osteomyelitis. On the other hand, in the developed world, where institution of antibiotics is early and prompt, hematogenous spread of infection to the bone is uncommon. Instead, direct extension of infection from the adjacent area, frequently involving the jaws and skull, is more common mode of spread. Bacterial osteomyelitis may be a complication at all ages. In patients with compound fractures, surgical procedures involving prosthesis or implants, gangrene of a limb, and diabetics, debilitation and immunosuppression. Morphologic features. Depending upon the duration, osteomyelitis may be acute, subacute or chronic. The basic pathologic changes in any stage of osteomyelitis are suppuration, ischemic necrosis, healing by fibrosis, and bony repair. The sequence of pathologic changes is as under. 1. The infection begins in the metaphyseal end of the marrow cavity, which is largely occupied by pus. At this stage, microscopy reveals congestion, edema and an exudate of neutrophils. 2. The tension in the marrow cavity is increased due to pus, and results in spread of infection along the marrow cavity into the endosteum, and into the Haversian and Folkmann's canal, causing periosteitis. 3. Combination of suppuration and impaired blood supply to the cortical bone results in erosion, thinning, and infarction necrosis of the cortex called sequestrum. 4. With passage of time, there is formation of new bone beneath the periosteum present over the infected bone. Long continued neoosteogenesis gives rise to dense, sclerotic pattern of osteomyelitis called chronic sclerosing, non-suppurative osteomyelitis of Garay. 6. Occasionally, acute osteomyelitis may be contained to a localized area and walled off by fibrous tissue and granulation tissue. This is termed Brodie's abscess. 7. Invertebral pyogenic osteomyelitis. Infection begins from the disc, discitis, and spreads to involve the vertebral bodies. Complications. 1. Septicemia. 2. Acute bacterial arthritis. 3. Pathologic fractures. 4. Development of squamous cell carcinoma in long-standing cases.